Okay, I'm going to get a little bit into why it's important to pick a good surgeon for your hair restoration procedure. And I'm going to go into much greater detail in this regard in future episodes. But today, there are various organizations that seem to either recommend a surgeon or they give you an impression that these surgeons are a good choice. And quite honestly, the vast majority are not. In other words, I would not send my brother to these doctors, and yet certain organizations seem to recommend or give or even give the public the impression that these physicians are recommended. They might just be members of an organization, but the public gets the impression they're recommended. So I want to go a little bit into what happens when you make a mistake and what kind of work is involved in resolving these mistakes. So it's not enough to look at an organization that appears to recommend a physician. You have to do a lot more research. You really need to go into much greater detail. And I'll tell you why. Many of these organizations, their criteria is they look at the photos and then they wait for patient complaints. If there are no patient complaints, which not many patients will complain even though they have a terrible result, then all they have to go on is a photograph. And I will get into why that is the worst, least responsible method of evaluating a medical practice. I mean, these guys, they have no idea how to do the surgery. They have no idea what is good surgery. All they can do is evaluate a photograph. And a photograph can be very misleading. So I'll get into that. But let's talk about what happens when you make that mistake. And this is a young man who had very little hair loss. And he went to a surgeon, and they grafted his frontal hairline with coarse hair and large follicular groupings. And they put numerous 2 and 3, even 4 hair groupings at or near the hairline. And they created what we would call a 0 to 100 mile per hour change. And a hairline should be a gradual transition from a bald forehead to 1 or 2 hairs stuck out away from everything. And gradually there's more hair, all 1 hair groupings. And then about a finger breadth back, you should see coverage. All right. So in that first finger breadth, you should see skin. So in other words, it's not 0 to 100. It's 0 to 20 to 50 to then finally 100 miles an hour. And so this patient is a patient that was grafted with a low, broad hairline and a 0 to 100 mile per hour appearance. Now, what did I have to do? It's 3 sessions of removing grafts. And this is, I think it's one of the most difficult procedures I perform. It takes the most amount of my time. These are, 8-hour surgeries, and we take out one follicular grouping at a time. And each time we go in, we're going to get somewhere between 200 and 400 follicular groups out in a 4 to 8 hour span of time. And so they're very expensive surgeries. So if you go to a surgeon and you think, I'm going to go to this guy, he's a little less expensive, he seems to be on a recommended list, I feel safe going to him. Well, I can tell you in this particular case, the patient has spent about 5 times what he would have spent if he just come to me initially. Okay? Now, I might be more expensive, but I'm also the most experienced FUE surgeon in the entire world. There's nobody that has more experience than I do. And you will hear people talk about their contribution to FUE. Well, I'm the individual who built the surgery. I'm the individual who created the first instrumentation for FUE. I'm the individual who promoted FUE when everybody else said it wasn't an acceptable surgery. I'm the guy who put FUE on the map. I'm the guy that created the initial results. And, I've been doing it the longest, and I have a tremendous amount of experience doing hair restoration surgery as well. So yes, I am expensive, but long term, you save money by going to the most skilled surgeons in the world. And when you take a chance with somebody else, you can wind up with, it took me 3 surgeries just to remove this hairline, just to take out all the grafts that contain more than one hair. And then we finally, after those 3 surgeries, we got to the point where we're ready to add hair. And now we've been through 1 pass of adding hair. And we're going to have to do another one because I don't want to go in there too densely after having just spent so many hours of surgery taking things out. And, the circulation is not going to be as good as it would have been if this were a virgin scalp. So I have to be kind of careful. It's going to take me at least 1 more session to get this hairline perfect, but it can be done. Unfortunately, when you go to some of these surgeons who seem to be highly recommended and capable, and even sometimes on TV, they might be in somebody's magazine that says they're the best in a city, which of course they're paying to be on these lists. They're paying to be in these magazines. And they wouldn't be paying to do these things if they were really that good. Because when you're really that good, people find me. I don't have to really advertise. So these guys have to advertise because they're not that good. And be careful, because when you go to the wrong guy, the corrective work is going to be more expensive, but not only that, you may not have the resources to finish the job. And we're going to show some cases where, physicians ruined patients and they're beyond repair because they destroyed all potential donor availability. Okay. Keep your minds open.
ForHair is run by Dr. Cole with 30 years of FUE hair restoration experience, and we offer the most cutting-edge technology available. In fact, the ForHair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose ForHair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of ForHair's video uploads. For online consultation, click on the link on the screen or in the video description.